the Indonesian Medical Society of Cupping. Welcome to all participants to the third medical cupping education with this with the theme cupping therapy for pediatric cases. Now, let us greet the chairman of IMSG, Mr. Dr. Qadri Fauzi. Assalamualaikum, Doc. And our honorary guest, Mr. Dr. Daeng M. Fakih. Assalamualaikum, Dr. Daeng. I'm fine, Doc. Thank you. And our most awaited speaker, Dr. Nivin Sharaf. Assalamualaikum, Dr. Nivin. Nice to meet you.
Waalaikumsalam warahmatullahi wabarakatuh.
Okay, this is very blessed event, inshallah. We have more than 40 participants joining from several countries like Indonesia, Norway, and Saudi Arabia. We are genuinely delighted to have each and every one of you and here to learn together about cupping therapy. Now I will present our program timeline. The first one is the opening session. We will have a welcome remark from the chairman of IMSG, Mr. Dr. Qadri. And then we will have opening speech from maybe from our senior, maybe Dr. Agus Rahmadi. I'm sorry, and correct him if I wrong. Yeah, okay. And after that, we want to followed by opening speech by Dr. Daeng. And next we will have our main session, a lecture from Dr. Nivin, followed by the discussion afterward. And then we have the closing session. So without further delay, let's welcome the Mr. Dr. Qadri Fauzi Tanjung as a chairman of IMSG for his opening remark. Please, Dr. Qadri, the time is yours. Silakan, Dr. Qadri.
Ya, terima kasih pada Dr. Andi. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahirabbil alamin. Wassalatu wassalamu ala asrofil anbiya'i wal mursalin wa ala alihi washabihi ajmain. Puji syukur kita panjatkan kepada Allah SWT karena berkat rahmat dan hidayahnya, alhamdulillah kita masih dapat bertemu pada acara edukasi Bekam Medik yang diadakan oleh Perhimpunan Dokter Bekam Indonesia secara online ini. Dan tak lupa selawat dan salam kita ucapkan kepada junjungan Nabi yang merupakan semua yang hati pembina Perhimpunan Dokter Bekam Indonesia yang hadir, yang saya hormati Dewan Pakar. Di sini hadir daripada Dr. Agus Rahmadi, yang saya hormati Dr. Rizka Siregar selaku Sekretaris Jenderal Perhimpunan Dokter Bekam Indonesia, yang saya hormati undangan kita Dokter, dan ini senior saya nih, mudah-mudahan hadir ya, yang saya hormati Dr. Ami Syarifuddin, kemudian tentu Dr. Andi Siregar selaku pembawa acara, dan seluruh pengurus Perhimpunan Dokter Bekam Indonesia serta simpatisan yang mengikuti daripada acara ini. Especially to the honorable speaker, Mrs. Nivin Sharaf, Medical Doctor LMCC from Ottawa Cupping Therapy. Assalamualaikum warahmatullahi wabarakatuh, Mrs. Nivin.
How are you today? Thank you for having me.
Yes. Good morning. Thank you very much to Mrs. Nivin Sharaf that willing to be a speaker and transfer knowledge at the third medical cupping education, which was held by the Central Board of the Indonesian Medical Society for Cupping. The Indonesian Medical Society for Cupping was founded in early January 2022, whose members are doctors who love cupping, medical cupping education is one of the activities as an elaboration of the vision and mission of the Indonesian Medical Society Cupping. Hopefully, the third medical cupping education can be a reference for those for us who practice cupping, especially the lesson will given Mrs. Nivin Sharaf for pediatric case. I think that's all from me. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi
Wabarakatuh. Thank you for Audrey for your warm welcome speech tonight. And next we will have opening speech or maybe a little speech by the one of expert council of IMSG, and the one he is also a prominent figure in Indonesian medical collegium. Maybe we want to for the opportunity for Dr. Agus Ramadi. The time is yours, Doctor. Please, maybe a little speech. Thank you, Doc. Dr. Agus, still in this
no,
forum?
he's not in the room anymore. Dr. Agus Hamadi is not in the room.
Okay. Thank you, Dr. Rizka. We will next the event. And now we will have an opening speech from the one of most important figures in the Indonesian medical doctor, former chairman of Indonesian Medical Association, Mr. Dr. Daeng M. Fakih. Please have your time for Mr. Dr. Daeng. Dr. Daeng, please, your time.
Baik, ya, terima kasih. Selamat malam. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi wabarakatuh, Bang Daeng.
Baik, ini saya melihat ada jadwal Dokter Amir ya, tapi Dokter Amir nggak ada ya?
Tadinya sudah terjadwal hadir, Dok, tapi ternyata beliau
Oke.
masih ada pretest. Jadi
baik.
beliau izin dulu gitu.
Baik, ya, baik. Kawan-kawan sekalian, jadi ini kalau Dokter Kodri saya kenal nih, meskipun nggak pernah jumpa ya, Dokter Kodri ya?
Ya Bang.
Ya, tapi saya kenal sepak terjang beliau, saya kenal sekali. Dan saya kira perkembangan dunia kedokteran itu kan luar biasa ya, berjalannya luar biasa. Yang penting, saya senang judulnya ini karena ada IBM-nya. Yang penting kita pelan-pelan mengumpulkan IBM tentang bekam ini, dikumpulkan, kemudian kita ajak diskusi, terutama kolegium, Dr. Kodri. Jadi kita ajak diskusi nanti pelan-pelan kolegium, mungkin pintunya bisa lewat Dr. Amir nih karena kolegium. Nanti juga saya bantu-bantu ke kawan-kawan kolegium yang lain. Kalau dari hasil diskusi terus-menerus tentang IBM bekam ini, mereka memahami dan terbuka, insya Allah tata laksana bekam ini akan menjadi salah satu tata laksana di bidang pelayanan medik ya. Kalau melihat beberapa yang lain jalannya seperti itu. Jadi kawan-kawan dalam rangka berjuang itu tidak boleh patah harang ya, atau kurang bersemangat gitu, tidak boleh, karena semuanya itu prosesnya sama, mengumpulkan semua IBM, tidak hanya di Indonesia, karena saya juga meragukan di Indonesia itu tidak pernah ada memang bukti-bukti IBM tuh, karena di Indonesia nih budayanya kan tentang riset kan kurang ya, kita cari yang tempat lain, makanya dengan mendatangkan beberapa ahli, apalagi ahli yang sudah pernah melakukan IBM, ya itu baik sekali. Tapi jangan berhenti hanya di situ. Dokumen-dokumen hasil penelitian yang bernilai IBM itu harus dikumpulkan dengan baik. Dengan seperti itu kita mudah lakukan. Mungkin itu yang dapat saya sampaikan. Saya minta maaf nih karena Dokter Muna hadir ya. Ini HP lagi kayaknya error, saya lagi ganti HP, nggak ngerti caranya ini. Saya termasuk orang jadul nih, menghidupkan videonya nggak paham, jadi
Siap,
maaf.
dokter.
Dan ya,
Kehadirannya.
ya, thank you for Mrs. atau Miss Nivin from Pakistan ya?
Mrs. from
Mrs.
Canada.
From Canada. Thank you. Give college for Indonesian medical about coughing on pediatric cases. Thank you, Mrs. Nivin. Thank you. Terima kasih ya, kawan-kawan semua, sukses. Mari kita perjuangkan bersama-sama. Mudah-mudahan ini menjadi alternatif pelayanan medis di Indonesia. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Yeah, thank you, Mr. Dr. Daeng. We really appreciate your support for IMSG. And finally, we arrive in the main session tonight, and I will introduce my colleague who will act as moderator for this session. Dr. Widana Primaning Tias. Assalamualaikum, Dr. Widana.
Ya, assalamualaikum.
Nice to meet you. Dr. Widana is a lecturer of public health in 11 Maret University in Solo City. She is a respected member of IMSG. She has involved in several community service projects and research as we presented here. So with all respect, the audience is yours now. Please, Dr. Widana, please. Thank you.
Thank you very much, Dr. Andi, for the introduction. Hi, everyone. Assalamualaikum warahmatullahi wabarakatuh. I would like to introduce to you, probably everyone already know who is our main speaker. She is a pediatrician, Sharaf. How are you, Doctor?
Alhamdulillah, thank you so much for having me, and thanks everyone for attending today. I hope this session will be beneficial for everyone, and I hope you learn and I learned something new today, inshallah.
Yeah, inshallah. Alhamdulillah. This is a really blessing event for all of us over here to learn together about the the owner of the Ottawa cupping therapy in Canada from 2006 until now, and then she's also an evidence-based medicine tutor at University of Ottawa. And then before, she has an experience as a senior lecturer, general and systematic anatomy in Al Faisal University, Riyadh, Saudi Arabia, and many professional degree education and also courses that Dr. Nivin already had. About the cupping, since 2017, Dr. Nivin already passed the Doctor of Pastoral Science license, contemporary cupping methods, advanced cupping techniques, facial cupping rejuvenation, and so many more. So we are very lucky, alhamdulillah, to have her here, and we hope we'll get a lot of knowledge and beneficial knowledge about cupping for Indonesian and also all another attendants from another countries. Okay, without further ado, I would like to give the stage to Dr. Nivin. Around 45 minutes from now, we will have the lecturer, and then after that, we will follow another discussion session around 25 minutes. Please, Dr. Nivin, the screen is yours.
Thank you. So it's okay if I share a screen?
Yes,
okay.
Please.
Bismillah. Okay, so yeah. So how are you, everyone? And welcome to the lecture today. I hope, inshallah, like I can add something new to whatever experience that I am sure like like you will have different experience than the one I have, and it is a good opportunity that we can learn from each other, inshallah. Before I start, if you can chat and type in the chat bar, unmute yourself and just tell me in one word or something what brought you to the pediatric cases today. Like, are you interested in pediatric cases? Are you working with pediatric cases? Or you're here to listen to something new? Or is it your area of expertise? And also, where are you coming from? Like, are you coming from a clinic, from a hospital, from a therapy office? Like, and also which country? It's going to be nice if we have this in the chat box. So we have better idea about like, you know, what to do today. So I want to start by speaking about myself. The thing that made me think about hijama for children is not only that I am a pediatric consultant, but actually the need, like the need of the parents, the child, and myself. So it's almost 100% of the cases that you are going to see today have been through a lot of therapy. They went, for example, to 2 years in physiotherapy or 2 years in family doctors, pediatrics, surgery, so many places, and they were given no answer. They were giving no treatment, or they were giving no diagnosis, or the medication did not work. So the therapy I provided was not to replace any therapy. I did not ask any of the people to stop any medication. I did not force a child to stay on the table or the parents. Basically, they come because they needed to. They said it is like end station, last thing they can try. Some of the cases were very easy. Some others took time. So if you see the picture in front of you over here, I don't know why my mouse is not working, but you can see this, the cup in the middle. There is a depression in the skin underneath. So when you apply the cup and you find this indicates there is restriction in the area. There is some gluing in this area happening between the layers of the skin and fascia underneath. With the cup, we do stretching, we do release of the pressure created under this area. So one of the explanation I give to the parents, I give to the child, is I show them how the cup works on our own hands. Like, I will give the hand like that with a small cup, and I will show them how it is working before I try on the child. I worked on so many children, so many age, like, you know, diversity. Any of you can suggest what's the youngest I have ever worked on? Can you type on the chat box? What do you think? How young was the
6 years old, or few months old, 1 year old?
Okay, another guess?
5 years old.
Okay, the youngest was about, he was my grandnephew. So my nephew is in China. He has half Chinese child that was born in the Corona year, and he had Corona when he was born. And he stayed in different hospitals in the intensive care, like pediatric intensive care unit, and he was destroyed with no full treatment. He was not able to eat. He was not able to breathe regularly. And my nephew had a video consultation with me I had the assessment, and I virtually taught him how to do very, very limited things that will help him through his case. Now, my grandnephew is 2.5 years old, and he's happy and he's healthy, and he actually chases other children in the daycare right now. This is the this was like the youngest case. So with the stretch technique, we do manage cases with scoliosis or kyphosis, especially mild acquired cases that they will acquire this position because of long texting or because of curving over the bed, especially in the corona like era. Some people or children will have scars after surgery, for example, hernia surgery, heart surgery. They have big scars that need to be attended. These scars are very beautifully managed with hijama and other kind of cupping as well, like, for example, myofascial release cupping, dry cupping, and magnetic cupping. I don't know if all of you are aware of that, but cupping has a lot of different techniques. Some of the like it's divided into the intensity of the cup, for example, like is it mild suction, moderate suction, deep suction, the type of cups you use. So sometimes we use plastic cups with normal dry cupping, or we choose to do scratches, so it's hijama, or we do glass cupping, which is like fire cupping, and all other kinds of cupping, like water cupping, like so many types of cupping that we are not going to tackle today, because I want to make it better to explain some of the cases that were really important for people to try, because there are many of them right now. Also knee pain and foot pain, especially with people who have no explanation with X-ray or ultrasound, or the doctors did not know why they do feel the pain. The other thing is the cupping increased circulation in areas that people will have a problem in. If you see this picture, like you can see some circles are darker than others. In this, I would emphasize on people who have COVID, that I always do around the diaphragm and basal areas of the lungs because of increased circulation. You attract more macrophage into the area and more circulation, then the virus will not have the time to replicate in these areas. And usually it happens after they are cured of, or like, they recover, and they are left with some cough, some restriction of breathing, like, asthma, for example, or for example, just phlegm. So we will do these areas just to release the congestion or the post-inflammatory reaction that is there in the lung. Like the thing is, most of these cases, as an evidence-based medicine tutor, I already researched, and not because everybody else did not try, I will not try, because these people did not have any other option. So you can ensure the safety of the person in front of you. You can ensure there is no harm, because this is our religion. We have no harm impacted on the child. That means that we go very gradually. For children, this child that was 6 months old, or 6 weeks old, or 4 weeks old, or this child that is 18 years old, all these people will have different cup applications, with very closely monitoring their body. How is the construction of their body? Are they strong? Are they weak? Are they anorexic? Are they muscular and athletics? Are they dizzy? Are you scared? All these kind of things will make the first session very different. After the first session, I have to monitor the child. I ask the parents and I ask the child, what happened after the session? If they say he had energy, he was happy, he spent the rest, especially with ADHD, like attention deficit hyperactivity disorder, they will say, oh, he was focusing, he did his homework, and there is no side effects. I know he's good. Next time I can add a little bit more or do the same. If they say he was tired, he didn't move a lot, he was lazy, he had some pain in his body, then maybe I worked a little bit more. So next session is going to be less intense than the first session. So I always go with the body. I tell everyone, I do not go with the book, I will go with your body. If inside the session, the person felt dizzy, they started crying, they asked me to stop, that will be it for the session. Very important to understand that with children and with no research published in this area, you need to research adults, you have to research what's in this area that the doctors probably missed. Like, for example, somebody came with headaches with no investigations. You cannot work on this. You have to ask them to go to the doctor, go get the diagnosis, get me the lab test, get me the imaging, and then when you work, you know, they have finished everything else before they come. I have worked with a lot of sleep problems, attention deficit hyperactivity disorder, developmental and mental delay. I remember one of the first cases that came to me was at 12 years old. He was not able to speak. He was not able to focus in the class. He was not even able to stay on the bed and allow me to do his cupping. He was very aggressive, bedwetting problem, and he was going to be dismissed from the special education school. Like, fast forward 5 years from this, he stopped bedwetting. He does 30 minutes math with the teacher, and he is looking for a part-time job. This was a big journey with him, and we managed to do about 1 or twice a month, according to the season, according to his mental health condition, according to the stressors that happen in the family. So if, for example, he witnessed an accident, he had post-traumatic stress disorder, I will have to see him sooner. If there is a fight that happened, or if there is an accident or anything like that, then we have to do closer sessions together. It's also known that cupping does immune modulation, especially in cases of rheumatoid and autoimmune disease. And there are plenty of like research papers that are published in this area. And I've quoted only this one here that tackled like this issue, and they say no adverse effects were reported from subjects after the therapy. Cupping therapy showed a reduction in inflammatory markers such as CRP and RF decreased significantly after cupping, and these lead to attenuation of rheumatoid arthritis symptoms. However, it is still needed more in-depth investigations to elucidate the detailed mechanism. So we have to lowest evidence-based medicine, but it has to be there. Somebody has to step down and say, okay, Rasul Sallallahu promised us there is a cure of every illness. If with, okay, this is idiopathic, this is non-manageable, this one we don't know, then why don't we try? What is there for us to lose? When there is no loss after the application, there is definitely a have two cases that I would that I love to mention about them. One of them was 6 years old with some rheumatoid-like nodules and arthritis, all her fingers, her wrists, and she wasn't able to go to school. That was not cleared with rheumatologists or pediatricians. They did not know what is going on. This girl had one of her relatives as a hijama practitioner. I did a little bit of assessment, and then what I do is I see the person in front of me, like the child. I see the physical appearance of the child. I see the posture. I see the muscle discrepancy between right and left side. I see if there is any visual like imbalance of the muscles or the body parts or any abnormality that you can get from inspection. And then I try to tackle that with the cupping things and combine this with some like detox program in terms of food. So, for example, I would ask the parents to stop, like, you know, sweets and refined sugars, and probably stop fried food, things that cause inflammation. And then we monitor from there. This child is now free from these rheumatoid nodules for the last 2 years. She does hijama every 2 to 3 months, very light ones, and she is so happy. She goes and she asked her relative to do it for her. Her relative is very happy, and the doctors are so surprised. Her blood work comes back negative of any inflammatory markers now. The other girl developed rheumatoid nodules, and she had a lot of inflammatory markers in her blood work, and rheumatoid nodules were so intense and so painful. And her mother brought her to me, and she managed to take like 6 sessions and weekly basis for 6 sessions. These rheumatoid nodules never came back, alhamdulillah, and her mother is very happy, and her inflammatory markers markedly went down. They are not back to normal yet, but they are about 1/10 from where they were before. Now for pain management, I think this is the thing that everyone now, even doctors, will ask their clients to go and do, or patients to go and do cupping because of the pain. There is 611 studies that examined like, you know, the relationship between cupping therapy and the chronic back pain. And the thing is, it is very nice, like very nice outcome. The only thing that people always, they want to standardize all the therapy we are doing, but sometimes it is difficult because what we work on in pediatric cases in our office is we do individualized approach. So when somebody comes with the same symptom, but the symptoms were caused with another thing, then you have to identify what's the reason this thing came. You have to go through the history, childhood. Sometimes it's a childhood trauma. Sometimes it's an event that happened during labor. Sometimes it is a medication that they just came. So like everyone has very different story than the other one. So standardization with limited people knowing about the therapy and limited people coming because of the same problem, then it will be difficult to do standardization in this case. I don't know if you guys agree or not. We're gonna do next. Okay, so I did have a lot of painful conditions that children experienced. One of them, he is very pleasant, old, like 10 years old boy that came with his mother with very hunched back and with very severe foot pain that he cannot even go for a walk. He cannot go to the mall to buy Eid clothes. He cannot go for a walk in the break. So he was mostly sitting most of the time. He went for foot doctors. They said maybe you will need surgery because he had a little bit of like, you know, a little bit of mess of his foot bones. So they wanted a surgery and they said, you are very young for the surgery right now. You have to wait until you're 18 and then you do your decision. Again, there was nothing to lose. So we did we did 4 sessions for him. And mashallah, like his foot pain is very mild after he walks for about 5 kilometers. So he's able to walk, he's able to do his breaks and everything. He will come when the pain starts to come back, he will come and ask for another session. His back also corrected. He started developing muscles and he started gaining some height. And this is very nice. And the mother was very, very happy. You know, when somebody experienced pain, his cortisol level is going to be high, and that will affect his weight, will affect his performance, and will affect his mood and reaction with his like, you know, siblings, his parents and all that. So the other girl that I cannot forget is a 16 years old. She came in 2016. She came with a collar, shoulders. Her father was holding her hand, and she did not handle my cup over her shoulder, even as a mild suction for the first time. She had chronic headaches. She was taking pain medications. She took marijuana. She took painkillers, Lyrica. She took carbacaine injections in her bag. She tried a lot of therapies, and then that was the last, place for her to go. Right now, she is free of pain. For the last 2 years, she is sending me her friends who have similar conditions. And she texts me and she says, "You're my second mom. You got me out of the misery that I was thinking about ending my life." This is a story of a girl that came to me also to stop marijuana. She's now free of drugs for the last 6 months. She is so grateful, and she is advocating for hijama among her friends. And she will tell them, go, and you're gonna be happy when you go. I do not promise anybody any cure, because healing comes from Allah. It's not us. We are only tools that Allah created to try to provide comfort for his creation. And subhanallah, like, because of the pain I am here today, like because of how much pain I was experiencing. And I also exhausted a lot of painkillers. I exhausted a lot of chemotherapy and immune modulators, and nothing was working with me. Like, I had like this plateau that I was in pain no matter what I take. And alhamdulillah, I wasn't going to be here today if pain medication worked with me. So subhanallah, sometimes it's there for us to learn and benefit other people from. This is another one that her dad was very, very aggressive when he came. He said, "I have stacks of receipts from all therapists because I have to get my daughter out of her headache. My daughter has migraine headaches, that she cannot leave her room. She cannot go to school. She's 15 years old. She was playing hockey, and somebody, like she fell, and then somebody hit her head with the hockey stick, and the other one fell on her. So it was whole body trauma, concussion. It was one side of the body in severe pain, and the migraine was the one that was killing her. We did the assessment over about 1.5 hours to let them understand, show them on the atlas how this affects this thing and how this affects this. I'm going to show you a picture after we're done, just to show you one of the simple things we can think about when we do the assessment for these children. Right now, her father is very happy. She comes only once a month, and he asked if he can get his friends and tell them about my services or not. Our services is not covered with insurance. They are not identified as physical therapy. They are holistic approach. So it is something that sometimes people will have problem paying. So I do offer some of free services in my office, but there is no sponsors. But I will select certain cases that we will help on, like whenever Allah permits us to do so. Speech problems also. I had 2 big cases of speech problems. One of them was a birth trauma, and he never had words done, but after each session, mashallah, the mother says, he said a new word, he said 2 words, he says 3 words. Now he's saying Salaam alaikum. He smiles and he answers in very short things. He still have a lot to work on, and the mother moved to another province, and I hope she is in a good hand right now, inshallah. The other one is now talking 2 languages, and understand 3, and he is looking for a part-time job. Both of them also have developmental delay and some mental delay as well. This is a girl that had pituitary cancer, and they could not resect part of the cancer because it was over on top of the optic chiasm. So it resulted in visual field defect. And the problem of the mother was she didn't want her daughter to, she's 10 years old, and the mother didn't want her daughter not to be able to drive when she grows older. So she came, and after alhamdulillah, she is now with complete visual field, blessing, like she doesn't have any defect. I'm asking the mother to come for follow-ups, but she's following up with the hospital, and if they say anything, she's gonna probably come back. There is this one is a boy that he was going about 3-4 times every year during the winter to the emergency room with status asthmaticus. So he will be admitted, he will be put into nebulizer, corticosteroids. I see somebody raise your hand. I think if you can hear me, I think you can wait to questions and answers. You can write them down so you do not forget them. Do I speak very fast if somebody can reply?
Yeah. Can you please, audience, I mean, ladies and gentlemen, if there is something that you need to say, you can write. But the question and answer will be in a couple minutes after this session. So I hope you can write in the chat box. Thank you.
Okay,
Please continue, Dr. Nivin.
So we spoke about the youngest. Okay, I know this is like a good pediatric thing, but I want to ask you what the youngest you guys worked on. Like, can you type this in the chat box?
Ya, Bapak Ibu yang pernah bekerja membekam maksud saya, boleh share pengalaman berapa tahun usia yang termuda yang pernah dibekap. Ada jawaban 7 years old, Dr. Nivin. 6 months old, Masya Allah.
Masya Allah. Okay, that's
Okay.
good. Masya Allah, Masya Allah. Okay. Masya Allah. 6 months. Not yet. Masya Allah. For the kids, I always use different things for different personalities. So people who have autistic disorders, they will be very specific on like to see everything, to understand everything, to ask for the tools I use for the hijama. Like one of them asked for the Chinese hammer. It's called a plum blossom hammer or Chinese hammer. Do you know what that is? Do you know how it looks like?
I don't know yet, Doc. Perhaps anyone knows?
Yeah, okay, so let me see if I can stop sharing this. Like, so I will put it for you after, okay? So they will ask for the tools. Some of them will ask for the blade, surgical blade. Some of them will ask for the hammer. Some of them will ask for the needle. Some of them will ask, this guy, he had emotional problems and he was 12 years old. And he asked me, can you put one cup here? And he held his temporal lobes. And his mother, because his mother knew the anatomy of the brain, that this is like where we control our emotions, she actually cried. She said, he feels where he wants to put the cup. SubhanAllah. So some of them will actually ask me where to put the cup sometimes. Also, like the duration of the session. Sometimes the session will be 15 minutes. Some of the time it's going to be 30 minutes, and sometimes it's 1 hour. So it is very important to make it custom made. It is this therapy is not like, you know, an antibiotic that we are going to take 50 milligram per kilo. It is not a pill that we are going to administer. We use it according to the person in front of us. So what happens with other like my students that finished my courses, they will sometimes have difficult cases and they are going to go through Zoom. They're going to book a session and then we open the video. I do the parents of the child have to be there to understand how are we going to tackle the issue. The therapist has to be there as well, and the child has to be there. And then last time I did an assessment through Zoom, it took for me 1 hour and a half just for the assessment and to develop the plan for this child. And it's gonna be, some people will come and they will say, we, even if he resists, still do it. I cannot do that. Force a child to stay and do something while he's crying. It is going to be bad. I do have my helper in the office. He is, mashallah, like 20-something years old. He's very talented, mashallah, to speaking to children. So if I have a male child that is resistant, I'm going to get him there and he's going to talk to him with his language and say, oh, come on, man, you're strong, you can do it. Why are you scared? You know, I just did it yesterday, and you will give him, show him a mark on his body, say it's not gonna hurt, you're gonna feel this after, and then he make them happy actually doing it. So having the child in and some of them are more religious than others. So the mother will say, oh, you know, Rasul Sallallahu Alaihi Wasallam, he did that. You don't want to be like Rasul Sallallahu Alaihi Wasallam. It's gonna, inshallah, heal you. Bi'idhnillah, you're gonna be better. It is better than having, you know, stitches and stuff like that. And then they are going to actually be convinced. So sometimes the first session is 2 hours, 3 hours, because we need everybody to be on the same page. So this is a little bit about how do we do individualized approach. So for the paperwork, we need to do both parents' consents, even if they were like separated. We will need to get both of them, because in the older days, like in 2016, it was considered child abuse if they find marks on the child without the child's consent and the parental consent, and then the school spotted something like that, the therapist can be responsible. So having parental consent is very important from both things. If the child is really young, you will ask the parents to record the session. So recording the session is going to prove that the child was not forced to do it. He was not like crying during the session. There is nothing bad that happened after the session. He took a toy after the session. All these kind of things. Okay, this is very important to obtain the parental consent. Sometimes I will also contact their family doctor to see if they have any, like, you know, considerations in particular cases. For example, Arnold-Chiari syndrome. So this is another thing. There is a lot of kids that come to the office because they wanted to detox and energize, especially non-Muslim kids. They will say they are lazy, they feel very weak, they don't get up very easily from the bed, they don't do activities at school, they have blocked appetite, anorexic, all these kind of things. This is something that they really, really like. Depression, especially after COVID, it improves the mood because of the endorphins. It improves the circulation of the brain. There is a lot of benefit in the coping for people with depression. For depression, it's also like it is very important to see if there is some toxic environment at home, if there is toxic words from the parents. There is a lot of parents that tend to suppress their children by words because they are perfectionists or because they have obsessive compulsive disorder. So I tend to speak with the parents and see the harmony between them and the child. And usually when they come to the office and they are contributing to the reason why the child has depression, I can see that right away. Why? Because they are going to be criticizing the child. Don't do this, don't do this, don't do that. This is bad. No, 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 for the whole session. So what happens is I will sit with the parents alone and will ask them, how many times do you praise him through the day? And they say probably once. How many times you ask him for things? Maybe 10 times. How many times you criticize them? All the time. When was the last time you hugged them? Maybe last week. So for this, it's very important to see if the parents are part of this or not. And not only for depression, it's for even pain conditions, because sometimes the pain is a result of shallow breathing. The diaphragm is going to be pulling the ribs in and the spine up. So it's going to be very difficult for the child to move with shallow breathing. I will show you some attachments of the diaphragm that you can be aware of after. There is
excuse me, Dr. Nivin.
Yeah.
The time is 10 minutes more from now? Or the
Yeah, I'm
lecture?
almost done. I
Okay.
think, yeah, I'm almost done. So there's only maybe 3 more slides. Okay, so we're going to be good. Thank you for the announcement. I was going actually to ask you. So there is post-vaccination adverse effects, especially carditis, sore arms, like, persistent body aches. They have amazing results with hijama. Post-COVID respiratory issues, we spoke about this before, but fire cupping is one of the big, helpers there because of deeper penetration. As you all know, probably that fire cupping was used to treat TB in the olden days. Amenorrhea, people who have a problem with their period, especially young teens. And they used, for example, birth control pills, they had strokes, and then they cannot use birth control pills anymore. Then they come and, mashallah, like a lot of success in this area. Myotonic dystrophy, and this is, I worked in a family for, like, they have history of consanguinity, so they're all relatives. And I had a couple of children there in the family that dramatically improved. Only one of the family members, who was 28, allowed me to publish his case. So I put the paper. We published a case of myotonic dystrophy associated with high level of creatine kinase. The whole family benefited tremendously from the cupping. The creatine kinase concentration went very down, and their performance and their muscle tones and their energy level and the level of their mental capacity, because it came with a lot of forgetfulness and stuff like that. It all improved with cupping. عن أنس قال رسول الله صلى الله عليه وسلم إن أمثل ما تداويتم به الحجامة والقسط البحري. Anas reported God's messenger as saying, the best medical treatments you apply are cupping and sea costus. And this is in Bukhari and Muslim. This is our beloved messenger told us 1400 years ago about this amazing therapy. And as I mentioned earlier in this talk, and I will say again, this is not to replace any medical treatment. This is not to be given as a promise to cure or heal. This is when you are sure you are not going to harm this person, because our deen has no harm. These 3 concepts have to be there for everyone. I will stop sharing this to show you a couple of pictures, and then it will be your question time, inshallah. So stop share. So here, stop share. So let me do this. And
yes, please, all for the audience, if you have questions, you can raise your hand or you can write in the chat box. We're still waiting for
I'm going to share like 2 things quickly. Like, this is first thing.
Yes, please, Doctor.
Can you see this?
Yes, it's clear.
So okay, so if we actually, I'm gonna do GIF here. You can see this picture here. Can you see the diaphragm here?
Yes, it is.
So imagine, like, trauma, any kind of trauma, like, somebody who's depressed, somebody who had, for example, chest infection, and then they ended up by shallow breathing. So the dynamic of the chest movement over here with the 2 crura of the diaphragm attached to the spine. So this is all like, 3-dimensional thing. and affects in so many aspects. So this is one of the things, for example, I noticed in people with ADHD, people with post-COVID things. So this is something that I have to work on, do mechanical release of the compression in this area. Like, you know, as I said in the beginning, like stretching it out and maintaining this. It's also disrupted with scoliosis, kyphosis, and obesity. Like all these things affect the diaphragm. This is one of the things. The other thing that I wanted to show you is called the Proic veins. So I'm using my daughter's computer. Mine, I forgot it in Egypt. I'll get it at the end of the month, inshallah. So I do apologize.
That's okay.
Yeah, this is the last picture, and then I'm gonna answer questions, inshallah. So let's see this picture here. So
epicranius muscle, frontal and occipital belly, bilateral.
So I wanted to show you how the veins of the like, you know, brain drain through the diploid veins, because we did not study this in medicine actually. So I'm just gonna make it larger probably. I'm gonna put it here. Okay, so I'm gonna Bismillah. Share screen. Okay, here. Can you see it now?
Yes, it is. Yes. It
Okay.
is there.
Yeah, so this is just to show you like the connection between the superior sagittal sinus in the brain over here, and then it actually pierces through the bones of the skull and then exit, and then it's connected with the scalp over there. So for us, we apply the suction here, so it actually helped a lot with not only migraine headaches, but also memory problem, behavioral problem, hair issues. It helps with memory issues, with post-traumatic stress disorder, with concussion, with brain tumors, actually, like even cancer. It helps the drainage big time. You can see that the diploid veins are everywhere. Can you see all these areas? And
Yes.
if you look, like there is another picture that I don't have right now, but it will show you that it exit actually they are and they are acupressure points. So when you tackle here, it is actually like rinsing the whole brain. Like, you know, it's very medicine. External carotid goes for the face and the scalp, and I did not learn about this anastomosis, which is spectacular. Like I see this as stunning, you know, because it's not only and also the cranial nerves that will go out in order for us to feel our scalp, right? So it is a whole thing that is that needs a lot of work. We need to educate people. We need to speak to doctors, as you guys are doing. This is amazing job that you're doing. Thank you so much for having me here today. And it's my pleasure that I came. And yeah, sorry that I talk too much.
Okay. Never too much, inshallah. Thank you so much, Dr. Nivin, for the exquisite presentation, and it's really beneficial for us. Now it's time for Q&A. There are some questions in the chat box. I would like to read the first questions from Andi Risva. the question is, what's the technique of the hijama between the adult and the kids or the children? Is it different from the cupping tools and the procedure? If it's really, really different, can you please share what's the tools and the procedures between them? Like, what's the differences? Thank you.
Okay, so the difference will depend on so many things. Like, for example, the age of the person. Like, if you are managing 6-month-old, you are not going to put 3 cups at the first session, for example.
Yeah.
You're going to do only 1 cup, very light suction. You are going to watch the child. How is he doing? Is it like, if you find he's a little bit apprehensive, like, you know, like he just, like, you know, his eyes are, like, you know, moving differently, he's looking at you, you're not going to put it anywhere except in the, like, C7, and after you feel there is C7, because you don't know if there is any abnormality in this area, you know. The suction has to be very gentle according to how his body tone is. The size of the cup is going to be very small. You're going to do 1 cup at a time. You are going to probably do only 1 cup in the first session. You're going to do a little bit of oil, like, you know, application first. You are going to make the mother, for example, hold him while you're doing that, and maybe reading him Quran, you know, so many things like that. The other thing is, why are you doing it? Like, why are you doing it for the child? Again, it is different. If somebody is having, for example, bipolar or no autistic disorder, for example, they are going to ask you so many questions. Sometimes they are going to be aggressive. Sometimes they want the same room, same tools, same setting. They do not want the change. So you have to prepare if you are going to do anything different. Also, as I told you, there is something called the plum blossom needle. Sometimes it's nice for the first timers. I will show it to you. This is one of the tools that I like with the so I will share the screen. I'll show you how it looks like. I'm sure some of you worked with it before. Can you see this?
Yeah, you can see that.
Yeah, they're a little expensive, but it's called 7-star needle or Chinese hammer or plum blossom needle. So I get those. They are disposable. So, sometimes I will get this for the same person. It's gonna have 10 or 12 in it, and then you change the head. Or you get the whole thing disposable, and then you just put it in the sharp container. It has 7 of them together, so you strike only once. Like, you're gonna do like this once, and khalas, like, you don't keep, like, you know, doing it. Also, I don't like using the blade so much with kids because I don't want them to have scratches. Their skin is so fragile and very thin as well. The application of the cup also shorter duration. So the first session can be like maybe 5 to 10 minutes, but after like convincing the child and everything, the whole session with the consultation is gonna probably be up to 2 hours if you're doing the right thing and to develop a real plan and stuff like that.
Okay, thank you for the answer. I hope it already clear, Andi, Rizka. It seems Sri Pujime, Mrs. Sri Pujime also have the same questions about the technique between the pediatric and adult. We move to the next question about the size cup for child, especially for babies. That special technique perform and how to make education for make sure for the parents before you perform hijama. Yeah, about sharing when make hijama in your pediatric patients. Thank you. That's question from Andi Sulaiman. Dr. Andi.
Yeah, this is what we just answered, right?
Yeah.
Isn't it or no?
Yeah, perhaps a little bit more details, Dr. Andi. Can you please, if you can say, you want any details added?
I needed, yeah,
So
I like it.
maybe how when you cop your the patient, how technique, maybe you can sharing to us by photo, or by photo is simple maybe, and how technique maybe, especially for the baby.
Oh, the baby. Okay, so for the baby, it's mostly 1 cup that I use for the first time, never more. Okay, even if he's good. If he's a little older, yeah, like 6 months to 12 months, I will put 1 cup, and then after I remove it, I will put another one and see. Okay, so the first session is going to be always 1 cup. I will do a little bit of moving cupping very, very gently, like lymphatic drainage. Okay, the thing with sharing pictures of babies, it has some copyrights because of the parents and because of the child. So if the child is below age, I need the consent of 2 parents, and usually they don't want to do that. So I do have I have pictures for adults, but for babies I don't. Like in my own practice, anything I share is usually from like already agreed from the parents. I actually think I do have a picture or 2, but I have to ask ask my helper to share it. So Riska, if I send it to you in WhatsApp, can you share with the group? I think I have like 2 or 3 pictures from 2 brothers that were coming for fun. They were just wanted to like, you know, like do like their parents. So they just wanted to have like some energy and detox and stuff, and they asked for cupping, and we asked them for pictures, and they agreed. They're about 6 and 8 years old. I'm gonna send you the picture, inshallah, on WhatsApp. Okay, I don't have it on me right now, but I do have it there, inshallah. The thing is, go gradual. If you are in doubt, I'm happy to help you out. Like usually I have my consultation online, like through Zoom, and I have a website I can also give you, Riska, and you can, if you want, I can give you 30% coupon because you attend this session, inshallah.
MashaAllah.
So you
Okay,
get
thank you
a
very
discount
much.
for 30%, inshallah.
MashaAllah.
Yeah, but the thing is, go gradually. Go when you are sure it is better, when the child start to get this, so like endometriosis. I managed endometriosis big time. It is very, very effective, mashallah, especially when they do laparoscope and nothing else helps. Very effective, mashallah.
MashaAllah, very wide range therapy that cupping can do, yeah, from adult to children, very various cases, MashaAllah. And this is another question about the psychological problem like depression. How would the cupping work? How can it cure the depression?
Again, it's not alone. Okay, so some people will have a problem with like multiple problems. Like for example, they are eating a lot of junk food, like a lot of burgers, a lot of sweets, and all that will add into their depression. So you will need to tackle this area. Some of them will have sedentary life, so there's no exercising at all. Every half an hour of cupping equals 2 hours of exercise. It increases endorphins in our body and increases circulation. Also, the depressed body will have a specific way. Like people who are depressed, they will have their shoulder curved down. So they will block their lungs from here. They will have shallow breathing, and their lungs are not going to be like having oxygen to all their tissues. So you doing the hijama improve the oxygen saturation in the blood. This is proven by research. It increases the endorphins and it improves the quality of the sleep. I also have some registered psychotherapists that I know they are Muslims, and some of them are free, some of them are reasonably priced. I will refer them to them. So it's usually multidisciplinary. I don't ask them to stop any medication if they started it, but I will also see what their sleep pattern, what kind of TV shows they are watching. So I will actually have conversation with them. One of them, she said, oh, this is more like, you know, a spiritual therapy. When I come to the office, they will feel their home because they open up and they talk to you. Usually physical, like physicians over here in Canada, they are overwhelmed since the COVID started. So the maximum you can get even with a specialist is about 7 minutes. So there is not enough for anybody to talk. So them coming to me for an hour and they will have this conversation. I'm a certified coach and trainer from John Maxwell team and from International Coaches Federation. So when I talk to them, I talk professionally. Like I don't give them like, you know, for example, oh, why did you do that? You know, like things like this, or I told you so, or like these kind of things that can trigger them. So they come, they feel they are safe, they're happy, and it improves them when they feel there is some, you know, support. Because like social support provide 33% of the treatment.
Correct. Yeah, mashallah, it's kind of whole approach, like inshallah. Okay. Okay, there is, yeah, why? Okay, another question. I'm afraid I cannot provide all the questions to you, Dr. Nivin, because the time, probably only one or two. The next question about the cancer cases with hijama, especially at the third, fourth stage cancer. Is there any experience you have about the cancer patient?
Yeah. Actually, I had a guy. He had his daughter having osteosarcoma, and subhanallah, like after we worked on her, it was already open. Like, you know, the osteosarcoma, it spreads very fast. It was stage 3. After the therapy, it became stage 1. It was encapsulated and they removed the tumor alone. He was very happy. I have worked with also this pituitary cancer. So with cancer, it's very, very short sessions, even with adults, very short sessions. They have to stop red meat. They have to stop fried food. They have to stop refined sugar. And with refined sugar, they can replace it with, you know, dates. They can replace it with manuka honey, or honey that is natural, not refined and not pasteurized. So they can replace this with it. Like I don't ask them to go for keto or whatever, but they have to detox. And if they insist on red meat because of anemia or something, they have to get organic or grass-fed. So there is no hormones there, because the problem with our meat is there is a lot of hormones. They either give you anabolic hormones because they want them to grow meat, or they give them like, you know, for a prolactin to produce more milk. And then people have problems with their pituitary gland even when they're young. I had a lot of pituitary adenoma cases. It's very annoying. So I tell them, just get organic milk or don't take milk at all, you know. Goat milk is good because goats do not take hormones, and also goat cheese is good because they don't take hormones. But try to ask them to be very strict with sugars, very strict with fried food, very strict with meat, hydrate, do not stress over. Always tell them this is part of you, doesn't identify you. Like, if I feel pain, that doesn't mean that I feel miserable. I can feel great, but my body has a little bit of aches. You know, it's different.
Yes. Mashallah. Thank you. It's a very clear answer. And then, unfortunately, there is a last question over here. Last question, Dr. Nivin. From Dr. Anna, do you have any cases with Ain or Jinn, you know, disease got from the eye looking Ain, and schizophrenia and having improvement with hijama? Could you please explain?
You mean Ain?
Yes, Ain, yeah.
Okay, so
okay,
this is okay. Okay, the thing is, you know, I believe in Ain and Hasad and Sihr and all these kind of things, but they are unseen and unknown. Allah said this. At the same time, He gave us the cure for them. The Qul huwa Allahu ahad and Ma'udat and Surah Al-Fatiha. He gave us the proper ruqya thing. If people ask me for ruqya, I do it. If they ask for hijama, I do it. If they ask for both, I do it. I don't charge extra for ruqya, so I'll just put it through the session. I'll read it. I'll ask the person to read it, ask the mother to read it. I do not give diagnosis.
Okay.
Diagnosis is only ghaib. It is
Correct.
ghaib.
Yeah.
We are not supposed to give diagnosis. The thing is, if somebody say, for example, oh, I have jinn in me, I have sahar, blah, 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 and then I tell them, I do not give diagnosis. If you want ruqya, I'm going to do ruqya. But I do ask them, if you react through the session, if something happened, you yelled at me, you started moving, you blah, 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 you know, if something happened, do you want me to stop or proceed? What do you want me to do? And that's before we start.
Yeah, like a consent. Yeah.
And it's a consent. And then if there's one family member, I make them stay. So I had like a funny story just to end with, like one of the girls, she came with her mother and sister, and then when I tried doing her cupping, then the cup started like breaking and flying. And then she started talking, and then they were running out of the door. I said, what are you doing? They wanted to leave me alone. I said, you stay here, you say this and put your hands, and I stopped like the session because I didn't know, like she didn't say anything before she came, and they said, oh, if we told you anything, you will just not do it. But sometimes things happen, you know, Allahu Alam.
Yeah.
It is all like something Allah created that we believe in, but at the same time, we are not permitted to give diagnosis or claim that we can treat them. But if that happened, be prepared, have somebody with you in the room, chaperone you, and do not comment. Do not comment. Just say, make dua. If you have zamzam, offer zamzam 7 dates every day. Don't go outside your home without your adhkar and all these things that Allah already created in the Quran. Our deen is complete. We do not need to make it more complete. Yani, subhanallah.
Yeah, mashallah. Alhamdulillah, all the questions, even though all of them being answered, but it's really complete from A to Z, inshallah. As a wrapping up, could you give a little message or, you know, any comment or any last knowledge that you would share before it's closing, before we closing the
Yeah, I would love to thank everyone and including yourself. Thank you so much for having me today. Thank you so much for listening and being there and for the interaction, beautiful interaction. And please just keep learning. Every day is an opportunity to learn. I go to any course when I find it, and I know there will be something new there that I will learn. And if I don't have courses to go to or learn from, open the internet and look into literature. If there is no literature, do your own literature. Be the change that the world want to see, because so many people are in despair. They're in so much pain, and it's you that you're going to help them when you have the proper knowledge and tools, inshallah. And never be shy. If you don't know something, it's better to ask and be confident and gain trust rather than doing mistakes and get, you know, a little bit of frustrations from both sides. And Allah ma'akum, and I'm very proud of you, all of you, and thank you so much for having me today.
Yeah, thank you so much, Dr. Nivin. We really glad to have you here, mashallah. Jazakillahu khairan katsiran for your words. Really help us all over here, especially me. I'm talking for myself because, you know, encouraging us to learn more and more, even though, you know, we are graduated, but we still have to learn more and more for the ummah, inshallah.
Ya Rabbi.
Thank you very much for everyone who attend this session. I would like to give the session to the Master of Ceremony, Dr. Andi Sulaiman Siregar. The time is yours. Thank you.
Okay, thank you, Dr. Widana, and thank you, Dr. Nivin, for your time and your knowledge for us. And Alhamdulillah, we have reached the end of our seminar. I think we all agree that this is a really great lecture and enjoyable discussion. I truly hope everyone learned something important and in their own circumstance, be able to use this knowledge for the better of Ummah, inshallah. And before closing, I hope everyone here can open your Zoom camera for documentation for us, and maybe we can take a photo session, please, for the all audience. Thank you. Oke, Mas, ini silakan, Mas.
Iya. Punten boleh semuanya kita on kamera dulu, akan ada sesi foto bersama. Ada 3 slide nanti, berarti kita ada 3 foto. Ini untuk slide 1 dulu, silakan untuk dihidupkan kameranya. Oke, masih saya tunggu dulu 10 detik lagi, kita akan sesi dokumentasi. Oke, slide pertama, 1, 2, 3. Selanjutnya di slide kedua. 1, 2, 3. Terakhir, slide ketiga, 1, 2, 3. Oke, cukup Dokter Andi.
Okay, thank you, Doctor, for the photo session. Thank you for all of audience here. And maybe Dr. Nivin, thank you, mashallah, tabarakallah. Maybe one day we can invite you to Indonesia and we direct to meet you. Okay. And on behalf of IMSG, I am apologize for any shortcoming, and we invite you to follow our social media here, and see you again in our 4th medical camping education in August, inshallah. And mashallah, jazakumullah khairan kasiran to all everyone here. I'm close for wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Semoga sehat-sehat di Mekah ya. Thank you Dokter Widiantias, moderator. Terima kasih Dokter Rizka semuanya. Dokter Abdurrahman, assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.